Our practice has offered primary care in the village for the last 60, 70, 80 years. We used to be sited at a house in the centre of the village that was originally belonged to one of the doctors, and as we got bigger, we got funding to build this premises. We've been on this site since 1984. This was a purpose-built GP practice for 4,600 patients and 8 staff, which is what we had at the time. We're now, roll on to 2023, we've now got nearly 7,000 patients and almost 40 members of staff, not all of whom who work full-time, and some of them have to work remotely. So as you can imagine, we're really stuck for space. We're bursting at the seams. We don't have anywhere to put in any new staff. We have to have quite a lot of our staff to work remotely because we don't have capacity in the building to situate them. And that all obviously causes problems with capacity offering services for patients. We're also a training practice, and we've been approached to take more trainees, and we think it's really important to train the doctors of the future and the nurses of the future, but we've had to say that we can't accept any more. We also are getting to the point where we're now going to have to shut our list to new patients because we're unable to offer a service to any more people. In the last 2, 3, 4 years, there's been planning permission throughout the village to have new housing built, which we all know is needed. But there are going to be approximately 700 houses, including a new nursing home, which are being built in this quite small village. And we're unable to cope with that extra capacity that will put upon us. So we approached Bradford Council a couple of years ago. We put in a planning application, which we've had successfully funded, to build a 2-storey extension here where I'm standing, coming out to the car park. And this will increase the capacity of the practice by 50%, which would make a really big difference and would mean we could offer hopefully high quality primary care to all those new patients that are coming into the village. I'm really sorry to hear that people feel it's difficult to get a GP appointment. All I can do is speak about what we do here at our surgery. And there's several ways people can contact us. So we have 2 different types of appointment. We have book on the day appointments, which are meant to be for immediately necessary things. So we don't run an emergency service in general practice, which I think people forget. So if you have chest pain, you're really unwell, you've had an accident, that's what A&E is for. But we cover everything else. So if your child has an ear infection, if you think you've got a chest infection, if you're feeling that there's a mental health crisis, any of those things, if you ring on the day, you will be given an appointment. Now, it won't be straight away, but it will be during the course of that day. So we would always offer same day appointments for anybody who feels that it's medically necessary to be seen. The other things are routine appointments. Now, routine appointments can be from anything. So the common ones we have are long-term condition planning. So it may be that you've got diabetes or high blood pressure, and we ask people to book those in advance. It's about 2 weeks for a routine appointment, the wait here at our surgery. I think one of the things that is quite frustrating for us is that these are once a year appointments to review your chronic condition, so they can be done at any time. And I know if I make an appointment, for example, to get my hair cut, I would have to make that 6 weeks in advance because otherwise there's no capacity. And I think people forget that actually we have limited capacity based on the amount of space in the building, the amount of doctors, the amount of nurses. We can't just have additional capacity, and some people want their routine appointment that week when actually that's not possible. So I'd say to people, please book routine appointments early. If it's your annual review, book it a couple of months in advance. That's absolutely fine. But then you get the clinician you want, you get the time you want, and it works really well. So that's the first thing I'd say. We also have those non-emergencies, but not completely routine appointments where people say may have been feeling unwell for the last week, 10 days and need to be seen, but not necessarily that day. And those are the people that we would try and maybe do some investigations before we see them. So there are 3 different ways people can contact the practice. They can walk in through the front door, they can ring for an appointment, and we have a new telephone system, one of the digital phone systems that the government's been talking about, which we've had for a few months. So it means that you're put in a queue, but you can also have the option to be rung back by the practice when a phone line becomes available. So hopefully it stops you having to hold on. But we also have an electronic access to the surgery. So it used to become something called e-consult. From the 1st of April, it's now been called Patches, and people can put in requests for things. So they tend to fall in two categories. Either the people I was talking about who may have felt that they've been unwell for 10 days, a couple of weeks, and want input from a doctor, but it's not urgent for that day. And we read all those, and we might suggest they have some blood tests or see a nurse for some investigations before they come and see a doctor. And that's really helpful because it's trying to reduce the amount of times you have to come to the practice. And it means when we do see you, we've got some answers there already. The other thing that people use the online forms, Patches, for things like admin issues. So they may need a sick note, they may need a letter for something, there may be a problem with their prescription. And actually that's a really good way for them to contact us because it's not using up a face-to-face appointment. We deal with those every day, so we get back to people in a timely fashion. But it also means if we are giving them an appointment, they can be given it with the correct person who can deal with their issues. The other thing that's happened since COVID, so pre-COVID, we did do some telephone calls, but we didn't have access to lots of the technology that we have now that was put in place at the time of COVID because we had no other way of contacting people. And some of that has really transformed our practice. So the fact that people can send in pictures of rashes, pictures of abnormal lumps, abnormal moles, to us is really helpful. In the past, people would come in saying, oh, I've had a rash for a week, doctor, but it's gone at the moment. And they try and describe their rash, which is really hard for people to describe. Whereas now they take a picture of it, they get a link from reception, they send it in, we look at it, we offer advice, we may then ring them, we may just be able to answer them back via text message and send their prescription to the chemist. So some things like that have really improved the care we can offer people. We also we're very fortunate. I'm a GP in a village, which is really nice because most of the people who live in this village belong to this practice. It's a village that has some farming community, has some elderly people who've lived here a long time, but it also has commuters. And it used to be in the past that people had to take a day off work or a morning off work to see the doctor. Whereas now, because a lot of that can be done remotely, either by telephone, video, email access, basically, we can deal with a lot of things in a way that's a lot more convenient to patients. And that has really improved how we can offer services to our patients who may be working in Leeds or London. And that's been a really helpful thing. We have other people other than doctors who offer help on that day or within a week or so. So people can self-refer themselves in for a physio appointment. So if you have a sore knee and it's come on over a few months, it might be better to see a physio than a doctor. And you can self-refer yourself into that and make your own appointment. We have pharmacists who work here now. So if you've got a prescription request, if you're struggling with your medication, patients can book in a phone appointment with a pharmacist at a time that suits them. Again, that's something you don't need to see a GP for. We also have a mental health team who work at the practice. We have several things for mental health. So we have mental health coaches who work as a crisis team. So they offer same-day triage. We offer those as on-the-day appointments, and we have those as extended access as well. So if you're at work, can't speak to somebody till after 6 o'clock, there will be appointments. It may not be that day, but it will be that week. We have a community psychiatric nurse who works within the practice who can offer follow-up to those patients and also work as a liaison between us and the mental health team for people with long-term mental health conditions, which is helpful. And also in Burley, in the village I work, we've set up a mental health hub in the village in combination with the community. So it's a drop-in service, open every Wednesday at the Scout Hut between 10 and 12. It's run by the counsellors from the practice and also the listening ear volunteers in the village. And again, that's open to everybody. People can drop in there as a once-off if they feel that things are difficult. And we have some patients with enduring mental health problems who will pop down there every week just for some ongoing support. I think that's one of the really special things about primary care within the UK and what has made it different from primary care in other countries. And it's one of the things that's attracted me to being a GP, and I'm really fortunate to work in a place where we still can do that. A lot of people feel that it's really difficult to maintain that in other places, for example, very big cities. We're in the fortunate position that we really know our community well, and it means then we can try and tailor our services as best we can to the community that we serve. We don't always get it right, but through working with the community, we try and focus where there's the biggest need, and we try and proactively manage those sections of the community that may struggle. Now, we do find that as we get busier and have to deal with more and more acute stuff, so for example, when there was the scarlet fever outbreak just before Christmas, we suddenly then have to divert lots more things to acute because we can't manage the capacity on the day, then it takes away our management of long-term conditions, our proactively managing the community. And that's the thing that's been a huge concern to us since COVID, because we feel that demand has gone up. It puts pressure on our long-term management of our community, which is something we don't want to lose. And that's a bit of a balance at the moment in primary care, in general practice in general. The better we manage the community, the less those people turn up in accident and emergency, which is often not appropriate for their needs. For example, enduring mental health issues. If you can manage those people before they become to a crisis, it's much easier to deal with. We have really good relationships with the schools in the area, with the local voluntary care sector. And again, that's to try and help us managing our population and the needs that it has. One of the things that has become hard in the last few years is our support services are not as available as they were. So they've been reorganised and we have less services, things like community matrons, which are a really good they kept people safe at home. They were a good liaison between the patient and the practice. Our community matron has just left. We have less health visiting services now than we used to. They used to keep the population of parents with kids under 5 really well supported. It's now become much more of a crisis model, which then has impacts on us. It requires us to then offer more appointments that we wouldn't have had to offer before because things would be managed by the health visitor. So things like that, the lack of community services that are just being pulled because of funding does impact on what we can then offer. So the Singing for Lung Health was set up in our community by one of our practice nurses, Sophie. So she's a musician when she's not at work as a practice nurse. She used to work in intensive care, so obviously working with people with lung conditions is very familiar to us. She'd done a respiratory diploma. It's something she's really interested in. And there's lots of evidence with people with long-term respiratory conditions helping them to manage their breathing better. It improves their life experience, really. It helps them to manage when they've got acute exacerbations because they can understand how to breathe better when their breathing feels very restricted, and it helps them feel more confident about what to do. So she's been running those in the local parish rooms, and they're run for a series of 7 or 8 weeks. I've been along to a couple of those to see what was going on, and it's really good. The exercises are quite hard, trying to learn to blow water through a straw, but as a really good way to control your breathing. But interventions like that are great, and we try and do those in the summer so that when people get outbreaks and exacerbations of their COPD in the winter, they've got some techniques which they can rely on. So things like that I think are really important. It's something that we've rolled across WACA. So WACA is our PCN, our primary care network in the area, and it covers practices through Wharfdale, into Craven and into Airedale. And so Sophie has been going to offer this course in those other areas. We have quite a large amount of elderly in this part of the patch, and therefore we have a large amount of people with chronic lung conditions. And it's fun. The patients seem to really like it, and the nurses really like it, and I think it works really well, and it reduces isolation. It gets some of these people out of the house who don't normally go out, and I think that's another good thing about it.